Now, if we want to revise the syphilis quickly, we have primary, secondary, tertiary, latent, and congenital syphilis. What is the most important character of primary syphilis? It's chancre. It's a painless ulcer. Differentiated from chancroid, which is a painful ulcer caused by Haemophilus ducreyi. Secondary syphilis, there are maculopapular rashes on throughout the body, especially on the palms and soles. And the maculopapular rashes which are present on the genital organs, they are called condyloma lata. In the tertiary syphilis, the most important character is the presence of gummas. They can be in the skin, in the bone, in the CVS, in the CNS, ascending aorta, tapes dorsalis. These are the various conditions. And gummas, they are chronic granulomatous inflammation, one of the types. In the center, they have a rubbery material, in contrast to the TB where there is cheesy material. In the latent syphilis, there is no sign and symptom. The patient is absolutely normal, but there are positive serological tests. And in the congenital syphilis, it passes through the placenta of the mother and the child is born with various congenital malformations. You can see from the book what are the congenital malformations. Now, what are these serological tests? Two types, specific and non-specific. Non-specific are VDRL and RPR, and specific are FTA, ABS, and Treponema pallidum heme agglutination test, fluorescent treponema antibody absorption test, venereal disease research laboratory, and rapid plasma reagent test. In specific test, from outside we use the antigens of Treponema pallidum, while in the non-specific test, we use the antigens from beef heart tissue. They are called cardiolipin antigens, and the antibodies are called anti-cardiolipin antigens. What are the other lab diagnostic signs? A very easy, very simple. We have dark field microscopy. You can use immunofluorescence and you can use silver test, but the most important is the dark field microscopy, specific test and non-specific test. And Treponema pallidum, it is spirochete and it's spiral shaped. It has axial filaments, which are the internal flagella, and they give a bending and forward movement. It is also called corkscrew motility. So this is a very short form of syphilis.